Why does my neck feel so stiff and sore? Why do I have tingling in my fingers? These are common questions, and often the answer is related to the condition called cervical spondylosis. This is a broad term for the age-related wear and tear that affects the discs and joints in your neck. While an X-ray might show some bone changes, a cervical spine MRI gives us the complete high-definition picture of what's happening to the nerves and spinal cord. Cervical spondylosis is best understood as a degenerative cascade where one problem leads to another. It typically begins with degenerative disc disease. Over time, the intervertebral discs lose water content and shrink, much like a grape turning into a raisin. On an MRI, a healthy, well-hydrated disc looks white and plump on certain sequences. A degenerating disc appears darker, thinner, and less resilient. This loss of disc height is significant because it reduces the spine's natural shock absorption and puts immense strain on the surrounding joints and ligaments. This disc weakness often leads to disc bulges and herniations. As the disc flattens and its fibrous outer wall weakens, it can bulge outwards, like a tire that's low on air. If that wall tears, the soft, gel-like inner material can push out. That's a herniation. An MRI allows us to see exactly where this disc material is protruding and, most importantly, if it's pressing on the spinal cord or pinching a specific nerve root as it exits the spine. When a nerve root is pinched, this is called radiculopathy, and it can cause neurologic symptoms like sharp, radiating pain into the shoulder or hand, numbness or tingling in the fingers, or specific muscle weakness, such as difficulty gripping or lifting your arm. Over time, this process contributes to spinal stenosis. As the intervertebral discs flatten, the ligaments thicken, and bone spurs form, the central space for the spinal cord, called the spinal canal, can become dangerously narrow. MRI is the gold standard for measuring the exact degree of this narrowing. It shows us if the spinal cord is simply being touched or if it's being actively compressed and squeezed, a condition known as myelopathy. When the spinal cord itself is compressed, the neurologic symptoms can be more serious and widespread. This can manifest as a loss of balance or coordination, making walking feel unsteady. Patients may notice difficulty with fine motor skills like buttoning a shirt or writing legibly. Other signs include weakness in both arms or legs, and a classic sensation of electric shocks down the spine when bending the neck forward, known as Lermit's sign. A cervical spine MRI doesn't just show one of these problems, it shows how they all interact to create the complete clinical picture of your neck pain and neurological issues, allowing for the most effective treatment plan.